Hello and welcome to the ASCO Daily News podcast. I'm Geraldine Carroll, a reporter for the ASCO Daily News. My guest today is Dr. Pamela Kunz, an associate professor of medicine and director of the Center for Gastrointestinal Cancers at the Yale School of Medicine. Dr. Kunz is also the Journal of Clinical Oncology's contributing editor for meeting abstracts. You may have seen her recent tweetorials highlighting compelling abstracts from the 2022 ASCO Annual Meeting. She'll be telling us more about this initiative to highlight impactful studies that address equity, diversity, and inclusion, global oncology, and more. Dr. Kunz's full disclosures are available in the show notes, and disclosures relating to all episodes of the podcast can be found on our transcripts at asco.org/podcasts. Dr. Kunz, thanks for being on the podcast today.
Thank you. It's my pleasure to be here.
Social media has created a global community in oncology, and you and Dr. Ryan Gensler of the University of Virginia Cancer Center recently launched a great series of tweetorials to highlight compelling studies from the annual meeting. Some of our listeners will have seen these threads already, and others will be keen to find them and know more about these efforts. Can you give us the details?
Sure, I'd be happy to. This is a new initiative to really modernize the meeting abstracts. These used to be called meeting proceedings and were printed, and we felt that there was a real opportunity to use social media to disseminate more information around abstracts. And we decided this year to focus on 4 themes. They are diversity, equity, and inclusion, global health, healthcare economics, and the Merit Award recipients. And within each of these tutorials, we have 4 to 5 abstracts that are highlighted that include takeaways and a visual from the poster or presentation. We intentionally decided to highlight abstracts that were not otherwise highlighted in the annual meeting in either oral sessions or poster discussions. So we are calling these hidden gems. There's so many great scientific abstracts that don't get otherwise highlighted, and this was a really nice opportunity to do so.
Excellent. And I understand you'll be highlighting a couple of abstracts for us today. I believe the first one concerns telehealth used by older patients. Can you tell us about this abstract?
Sure. So this is in the Health Equity Tutorial, and this is abstract 1591 by Dr. Higashi and colleagues. I found this interesting, and the disclosure is that I selected these abstracts given my own personal interest, but I thought that they would be of broad interest to the ASCO membership. So telehealth really became used quite often during COVID, and I think that has been a real silver lining, that there is increased access to expert cancer care through the use of telehealth. This abstract demonstrated that the use of telehealth during cancer treatment was really received positively by older patients, providers, and staff. Most older patients, 66%, and providers and staff, 77%, intended to continue using telehealth after the pandemic. There are certainly some equity issues related to telehealth in terms of access to internet and the ability to use the technology, but I thought this was interesting because it's specifically focused on older patients.
Excellent. Telehealth certainly has been a game changer in oncology. Now, I believe the second abstract that you'll be highlighting addresses the use of supportive care in pancreas cancer, correct?
That's exactly right. So this is in the Merit Award tutorial, and there are so many fantastic Merit Award recipients. It was actually very difficult to select just a few to highlight. In the tutorial, we will be providing the link to all of the Merit Award recipients, so I encourage listeners to really go look at that. So this specific abstract that I wanted to mention on today's podcast is abstract 4154 by Dr. Chris Kann and colleagues. They examined through the National Cancer Database over 150,000 patients with locally advanced pancreatic cancer and found that only 2.9% received supportive care treatment, despite over 65% of these patients receiving care at an academic program. And so I think that it just really highlighted the need for these patients to really utilize supportive care programs. Perhaps sometimes we have a bias that we refer patients with metastatic pancreatic cancer to supportive care programs, but there's an opportunity to take advantage of these services earlier.
Excellent. Well, Dr. Kunz, looking ahead, do you think there's scope to leverage social media more in oncology? Tweetorials, for example, are a great vehicle for education and a way to address topics that don't get as much attention as we'd like.
Absolutely, Geraldine. This was a pilot this year with Dr. Ryan Gensler and myself. There is an active social media editor, Dr. Shannon Weston, who's a consultant member of the JCO editorial board as well. And I think in partnering with the annual meeting social media team, this has really been a team effort. And we are hoping to do more of this in future years, and in particular, take advantage of creating opportunities for perhaps fellows and junior faculty to assist in disseminating some of this information via social media.
Absolutely. This is an incredibly important initiative that will benefit oncologists, patient advocates, and patients alike who are on social media to learn about advances in care. So it's really important that we let our listeners know where they can find these tutorials. You are on Twitter at Pamela Kunz, MD, and Dr. Ryan Gensler is at Ryan Gensler. Dr. Kunz, is there anything else you'd like to add before we wrap up the podcast today?
Well, thank you for the opportunity to highlight this. I think we would also welcome suggestions from our listeners. If you are reading the tutorials, they can send me a direct message, and we'd welcome suggestions for future years on how to highlight other science from our annual meeting.
Absolutely, and we'd certainly like to encourage our listeners to share these amazing tutorials. Well, Dr. Kunz, thanks for coming on the podcast today and for your efforts to elevate abstracts and investigators who are working really hard to address some complex issues in cancer care.
Thank you for the opportunity.
And thank you to our listeners for joining us today. You will find links to the abstracts discussed today on the transcript of this episode, and we'll post the Twitter handles of Dr. Kunz and Dr. Gensler in the show notes. Finally, if you value the insights you hear on the ASCO Daily News podcast, please take a moment to rate, review, and subscribe wherever you get your podcasts.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.